Labour must raise GP funding to end the 8 a.m. scramble, says doctors' groups. We're going to read into this more from The Guardian, you guys. Let's go. Good morning, good afternoon, good evening, wherever you are in the world. This is Reganelite here with an article from The Guardian with the headline that Labour must raise GP funding to end the 8 a.m. scramble, says doctors' groups. General practices are forced to do more and more with less and less, says Doctors Association UK. Guys, while you're here, make sure you hit the like button and share this across social media so others are notified of this video. This is an issue, like so many issues, that the Conservatives have left for a Labour government to pick up. Whether the Labour government will issue funding, obviously, is a question. Unfortunately, like I say, with any funding that Labour are going to provide for things, 9 times out of 10, you're going to have to wait for the budget, which won't be till the end of October, when the Chancellor announces what's going to be in the budget. They're always going to be trying to be physically responsible with the economy that Labour are going to be. I don't know if just throwing money at this is going to solve the issue, but there's absolutely no question that something needs to be done, because as we know, it's very difficult right now for people to get to see the GPs, to see their doctors, and yeah, everyone is all calling in trying to get an appointment when they need it. And some of them are forced to having to go to either to A&E or go to a pharmacy to get something to help keep them going until they can get an appointment through to the next day. It's an absolute nightmare for some people. It can be an absolute headache, especially with so few GPs that we have, the less GPs that we have. Something does need to give. There is absolutely no question about that. But is it just a case of funding? Or is it a case that money is not being managed properly? I'm just asking questions. And I think there's questions that's worth asking, you guys. I really do think it is. And let's hope this does get solved. I don't think you can just I understand people want things sorted now, but it's just something that Labour do need to address on top of many other issues within the NHS as well. That is for sure. So Labour's promise to end the 8 a.m. scramble for medical appointments will be impossible without increasing core funding for GPs, according to a leading medical association. So the Health Secretary, Wes Streeting, pledged during the general election campaign that Labour would end the 8 a.m. scramble by allowing patients to easily book appointments to see the doctors they want in a manner that they choose. But the Doctors Association UK said more funding is needed, with the organisation's GP-led Dr. Lizzie Toberty saying that at least another £35 for each patient a year is required to match the funding levels from a decade ago. We've received the same payment per patient per year, no matter how complex, no matter what they were doing, no matter how many appointments they have, Toberty told the newspaper. The payment had not been uplifted in line with inflation or patient need. So with over the years, primary care has to do more and more with less and less, which can be seen as difficulties people having getting to see their GPs, and in terms of patient satisfaction, she added. The NHS paid an average of £164.64 for each registered patient in 2022-2023, according to recent data. Despite the high demand for GP surgeries, less than 10% of £165 billion NHS budget in England is spent on primary care. As of April, there are 2,294 patients per GP. That is a 7.2% increase since 2019. In a 22% increase from the year before, 60 million, or so say nearly 61 million appointments took place in more than 2 weeks after being requested between January and December last year, more than 3 times the 6% rise in total appointments. A Department for Health and Social Care spokesperson told the PA News agency that the government has committed to recruiting over 1,000 newly qualified GPs through the £82 million boost to additional roles reimbursement scheme in the hopes of easing the workload facing the 27,000 full-time, fully qualified GPs working in England as of June. Well, clearly we need more, because something's got to give. This government is also accepting the review body on doctors and dentists' remunerations pay recommendations of a 6% uplift to pay, and it's consulting on the implementation, the department spokesperson says. Yeah, we need to give, yeah, if we give them better pay, they will stay within the profession as well. That will help. In a letter to the representative body for GPs in England, the government said that it will fund 6% uplift with a 7.4% increase to the global sum of 2024-2025. Toberty argued that this would not be enough funds to the pay rise. It is a step in the right direction, but again shows a misunderstanding of what's actually happening in general practices and introduce in doctrines of the funding module, she said. Essentially, we need a new, less convulsed contract. Earlier this month, family doctors voted overwhelmingly in favour of staging industrial action for the first time in 60 years to protest against a new contract in which the last government agreed to a 1.9% funding increase for 2024-2025, seen as visibly unviable by the British Medical Association. Yeah. Everyone remembers the doctors' strikes. It was absolutely insane that our NHS workers were forced to strike because their pay was just so crap. It really, really was. It was absolutely ridiculous. That's never happened before, but that happened under the Conservatives. They allowed that to happen. They could have dealt with it, and they chose not to deal with it. Guys, let's be very, very clear about that. But they are saying without categorically doubt that funding must be needed. Now, is funding going to be the be all and end all? Like, it's all well and good providing funding. If the Chancellor will give that funding, that is another question. But if they do, obviously, it's about how and where that money will go, and that is going to be the key thing. If Wes Streeting has said that he wants to end the 8 a.m. scramble, it's going to be a right challenge to do so. It is, like I've said many times, guys, on a lot of things that since Labour have come to power, things are going to take time. I know people don't have much patience, but we got to give at least see what they do in the first 100 days. That will speak a lot of volumes about this government and what he has done so far. As I said right at the start, since they came into power, action, not words. But if we do start to see less talk about it, if we actually start to see people able to get the appointments that they need, then the Labour are doing the right things. But it will all take time, as I've said before, guys. But not just what I think. What do you guys honestly think? Do you think Labour will end the 8 a.m. scramble? Do you think the Chancellor will provide Wes Streeting with the additional funding he needs? Do you think Labour will provide any additional funding at all to tackle this issue? Let me know your thoughts and more down in the comments section below. If you found this video informative, please hit the like button. We greatly appreciate it. Share it across social media so others are notified of this video. If you haven't subscribed already, please consider subscribing because it really does help support the channel. And if you want to go one step further, financially support me and the work that I do here, you can do so by becoming a YouTube member for as little as 99p, or join me on Rumble or Patreon for exclusive content on those platforms. So thank you all so much for watching, and I hope to catch you all very, very soon.